Hi, I'm Dr. Suvarachala from Ziva Fertility Centers. I work as the scientific director there. I would like to talk to you about sperm DNA fragmentation today. When we do a routine semen analysis, all we can look at is probably the volume, the count, motility, morphology, and how the other accessory glands, as in secondary glands, are working, as the prostate, the seminal vesicles. We can get a certain idea about how the other organs are working as well to be able to produce the ejaculate, and what is the quality and quantity of the sperms present in the ejaculate. But what we cannot understand is how the DNA is packaged inside the sperm. Now, by that you will have to understand what happens during spermatogenesis or when the sperms are being produced. When sperms are being produced in the testis, they are immotile. So, they are produced in the testis and they have a long journey to take until they are ejaculated. While 3000 approximately sperms are produced every second of a reproductive age male, you have to understand that by the time they are ready to be ejaculated, it takes about 72 days. So, it is quite a duration and quite a long journey for the sperms to take. Now, during this journey from the testis to the ejaculate, there are so many tubules and so many glands that they have to cross over and change their general environment around them, that it could also lead to a little bit of damage to the sperm itself. So, what are the types? One could be that while it is being produced itself, the sperm was not originally intended to mature and be ejaculated. So, but it escaped the chance to be to die. We call it apoptosis. So, it escaped that chance to die and continued the journey. So, what happens basically inside such a sperm is that the DNA which is packed inside the head of the sperm has breakages. It is called DNA fragmentation. Not just that, there could be an infection in the man's body. He could have had high temperature over the last 3 months, which resulted in high DFI, DNA damage to the sperm, or it could mean that this person himself is working in a very hot environment. He could be a chef who is exposed to temperature. He could be someone working in a factory which has a lot of heat inside it. So, there is a lot of heat exposure to this person, which results in high DNA fragmentation. In addition to all this, person could be of advanced age, so he is 45 or above, which is a normal phenomenon to occur in males who are over 45, that the DNA fragmentation also slowly increases. So, these are the causes of DNA fragmentation which could occur naturally, but if you look at certain other factors such as being subjected to chemotherapy, if he had some cancer and he was subjected to chemotherapy or radiation, sperms undergo severe damage to their DNA and cause a very high increase in the DNA fragmentation index of the entire ejaculate that we have. So, that is another cause. You could be smoking as well, smoking, alcohol, diabetes is known to cause high DNA fragmentation. All these factors contribute to this, and I will tell you now the relevance of DNA fragmentation. Does it mean anything at all? So, when we have to go back and see what it does to the sperm and what it does to the embryo that is formed in future. Now, the sperm itself is DNA fragmented, isn't it? The fragmentation is occurring in the DNA. It means that the code that is being carried into the egg for fertilization also is damaged. It needs to be complete. The language inside the genes which are coming from the father has to be complete. So, incomplete DNA is carried into the egg. So, such a sperm may not have the capacity to fertilize the egg. Even if it does fertilize, maybe the quality of embryo may not be good, and even if we have embryos that are of average quality and we do transfer it into the uterus, maybe the embryo won't implant, and if it does implant, it leads to miscarriages. So, what is the statistical data saying? When we look at the data that is presented by so many clinical researches happening, every checkpoint that I have talked about, fertilization, formation of good quality embryos, implantation, and then leading to good babies, everything has a relevance to DNA fragmentation. So, it is very, very critical that the DNA fragmentation be low and the factors that I have talked about be controlled, at least the ones that can be controlled, that could lead to a better quality of sperms. So, that is the relevance of DNA fragmentation. If you have got the test done, or if you would like to get the test done, please feel free to contact us. You can see the numbers on the screen, take an appointment, come down, we do this test, and we can tell you what the DNA fragmentation is, and probably that's the reason why you are grappling with infertility from your side, from the male side. Thank you.